Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for this CPB-CPC practice exam review. In this presentation, we will review an introduction to the ICD-10-CM with 10 exam questions. Question 1. What is the ICD-10-CM code for essential HTN? To answer this question, we must know what the abbreviation HTN stands for. HTN is shorthand for hypertension. Open the alphabetic index of your ICD-10 manual and turn to hypertension. Looking at hypertension, we can see essential is included in a parentheses. The ICD-10-CM alphabetic index, the words in parentheses are called non-essential modifiers. These terms provide additional information about the diagnosis, but do not affect the code selection. In other words, whether the non-essential modifier is present or absent, the word essential does not change the meaning of the diagnosis hypertension. Therefore, the correct code would be I-10, which we would then verify in the tabular list to confirm. Question 2. What is the ICD-10-CM code for DM? DM is the medical abbreviation for diabetes mellitus. In the ICD-10-CM official guidelines section 1C4A2, it states if the type of diabetes mellitus is not documented in the medical record, the default is subcategory E11, type 2 diabetes mellitus. In the ICD-10 alphabetic index, look for diabetes. We can see again that mellitus is a non-essential modifier. You are referred to E11.9. In the tabular list, locate E11.9. That is the correct code. Question 3. What is the ICD-10-CM code for back pain? One key thing to notice in this scenario is that no location is given for the back pain. This is unspecified back pain. In the ICD-10-CM alphabetic index, look for pain. Then we would further search for back. You are referred to M54.9. In the tabular list, locate and verify M54.9 is the correct code for back pain. Notice the description, back pain NOS. This is back pain not otherwise specified, making this an unspecified code for back pain. The correct code is M54.9. Question 4. Let's revisit this question, but instead of unspecified back pain, let's say the chart note reads the patient has lower back pain. In the ICD-10 alphabetic index, look for pain. We would then further search for low back pain, which directs us to M54.50, which we would then verify in the tabular list. As you can see from the entry, if the patient had been diagnosed with low back pain due to vertebral and pain plate issues, we would use a different code. As a reminder, the number 5 in the red circle with the red circle around it means this code requires a 5th character to be correct. The exam might try to trick you, though, by only listing M54.50 as an option. This would be incorrect, though, as the 5th character 0, 1, or 9 is needed. The correct code is M54.50. Question 5. When a patient is admitted for chemotherapy for cancer, what code is reported as the first listed diagnosis? In the ICD-10-CM guideline 1C2E2, it states if a patient's admission or encounter is solely for the administration of chemotherapy, assign code Z51.11 as the first listed or principal diagnosis. From the index, reference chemotherapy for cancer. Verify the code in the tabular list. You might be wondering how you will remember about the official guidelines. In the AAPC ICD-10-CM, you will see an I icon, which is reminding you that there is a guideline that should be referenced when assigning this code. If you do not have this version of the book, we recommend that you make a note next to the ICD-10 codes throughout your book, which guidelines apply to. Also, this is another example where the 5 is in the red circle, indicating at least 5 characters are required for this code to be valid. The correct code is Z51.11. Question 6. Patient presents with difficulty speaking, facial droop, and she is unable to close her left eye. She has no other complaints. She is diagnosed with Bell's palsy. She is prescribed corticosteroids. She will return in 3 days for follow-up. What is the ICD-10 code or codes that are reported? In the ICD-10 alphabetic index, look for Bell's, then palsy, which leads to G51.0. Verify the code in the tabular list. Signs and symptoms of facial droop and difficulty speaking are inherent to Bell's palsy and not reported separately. We do not report signs and symptoms when a definitive diagnosis is known unless there are specific instructions within the tabular list indicating we should do so. Those are not present here, therefore the correct code is G51.0, Bell's palsy. Question 7. Patient is admitted with neoplasm-related pain from malignancy in the right upper lobe of the lung. She will be seen by pain management and a pain pump is inserted. What is the ICD-10 code or codes that are reported? When pain is caused by or related to cancer, whether primary or secondary, a code for neoplasm-related pain is used. In the ICD-10 alphabetic index, look for pain due to cancer, and you are referenced to G89.3. Lung malignancy is referenced in the table of neoplasms under lung and upper lobe in the column for primary malignancy, which leads you to subcategory 34.1. Notice the dash after the 1. We'll want to reference these both in the tabular list. C34.1 needs a 5th character of 1 for the right lobe. Sequencing of codes will depend on the reason for the visit. In this case, the patient is being treated for the pain, so G89.3 is the first listed diagnosis. The underlying neoplasm is reported as an additional diagnosis. The correct codes are G89.3 and C34.11. Question 8. An OB patient at 36 weeks presents with mild headache and leg edema. Her UA shows protein. She is diagnosed with preeclampsia and admitted for observation. What ICD-10-CM codes are reported? OB codes are located in Chapter 15. Coding guidelines state that Chapter 15 codes have sequencing priority over codes from other chapters. In the ICD-10 alphabetic index, look for pregnancy complicated by preeclampsia, which leads to subcategory 014.9. The notes at the beginning of the chapter state that the 3rd trimester is 28 weeks until delivery. The 5th character 3 is used for the 3rd trimester. We must also use an additional code from category Z3A, weeks of gestation, to identify the specific week of the pregnancy. Z3A.36 indicates that she is 36 weeks pregnant. Verify all codes in the tabular list. The correct codes are 014.93 and Z3A.36. Question 9. Patient is seen for urinary symptoms that include nocturia, hesitancy, frequency, and weak urinary stream. Exam reveals that the patient has an enlarged prostate. What ICD-10 codes are reported? In the ICD-10 alphabetic index, look for enlargement, prostate with lower tract symptoms, which leads to N40.1. Enlarged prostate with lower urinary tract symptoms. Lower urinary tract symptoms is often abbreviated to LUTS. When verifying in the tabular list, a note states to use an additional code for associated symptoms. The nocturia, hesitancy, frequency, and weak urinary stream are listed as associated symptoms. The correct codes are N40.1, R35.1, R39.11, R35.0, and R39.12. Our final questions. What is the ICD-10 CM code for the first encounter for a left wrist fracture from a fall? Code the injury only, not the external cause or the fall. Fractures can be traumatic due to an injury or accident or pathological due to a disease. In the ICD-10 alphabetic index, look for fracture, traumatic, and wrist, and you will refer to subcategory S62.10. Turn to the subcategory S62.10 in the tabular list. Most fractures require the 6th or 7th character. From the indented listing in the subcategory, you will see the 6th character is for laterality. S62.102 specifies left wrist. For the 7th character, reference the list under the category heading S62. The note under this heading indicates a fracture not indicated as open or closed is coded as closed. Then it lists the appropriate 7th character. A is for the initial encounter for a closed fracture. The correct code for this wrist fracture is S62.102A. Thank you for joining us. For more CPB and CPC practice exam questions, please visit our website at medicalbilco.com.